So this next video is about care planning and using the nursing process to identify a patient's set of needs. Now, sometimes care planning and assessment is brought up at interview for the NHS, but it is very much a focus for the interview for care home sector. Now, using the nursing process, which is assessment, planning, implementation and evaluation, you can identify a patient's individual needs and develop a care plan based upon those needs. Guidelines for writing a care plan include a comprehensive assessment of a patient's physical, social, emotional and mental needs, and each nursing home might have a set of standard protocols to use when assessing a resident's needs. Quite often in the NHS you have pre-written care plans that you can place into a patient's folder that are based upon that patient's needs. So if a patient's going for routine surgery like a hip replacement, there probably will already be a pre-written care plan that you can then adapt to that patient's needs. So after assessment, we need to develop a list of the patient's problems, and the problems can include medical diagnosis, physical weaknesses, family problems, social withdrawal, and any other items that affect the patient's well-being. For each problem listed, you need to determine whether you can put in place interventions to improve that problem or that need. So here's an example of how you can formulate a care plan based upon individual needs. So John is an 82-year-old man who was admitted to your care home following a fractured neck of femur, which he had fixed in hospital. He was living at home before this, and then he was transferred to your care home. He had a history of worsening dementia pre-admission, and during his hospital stay, he lost 10 kilos in weight. So first of all, we need to assess him fully, and we need to look at a full set of observations. We need to assess his height and weight. We need to look at all his medical notes and his medication, assessment of his skin integrity, assessment of his risk of recurrent falls, an assessment of his mobility and whether he needs any extra aids to help that, and also an assessment of his dementia. You should also assess any other medical, social or psychological problems that he might have. Care plans should deal with one problem at a time. So looking at the scenario, John has lost a considerable amount of weight due to his hospitalisation, his dementia and his lack of appetite, and he's at risk of developing further malnutrition. John is disorientated at times and he's at risk of further falls. He is at risk of developing pressure sores because his mobility isn't very good. He needs to be orientated and supported as best as he can during his stay at the home. He may need help with mobility and he might need mobility aids. And he also needs help with his activities of daily living, such as washing, dressing, and assistance with feeding. So the first problem that I've identified, that's the main problem, is that he has a reduced appetite and weight loss due to his recent hospital admission and also his worsening cognitive function. So the risk is that he's got further weight loss and poor nutritional status. So that's his problem. Then we need to identify the goals. So the goal would be for John to gain or maintain weight and for him to have additional nutritional intake. So the interventions that you would need to do as a nurse, you'd need to look at weekly weights. You'd need to look at a diet which would suit John's needs and his likes, that he would have to have regular snacks and nutritional supplementation, and observe his appetite and complete a fluid and food chart. And also you'd need to monitor his bowel habits as part of that problem. And this would need to be reviewed daily until his goal weight had been achieved or until this problem had been resolved. After assessment of John's needs, it's identified that he is disorientated at times due to his dementia and he is at risk of further falls. So in order to put in a care plan, we need to think about the goals. So his goals would be to prevent any further falls, to orientate John fully to the home, and to maintain his independence but also maintain his safety. And to do that, we would have to do a risk assessment for falls. We'd need to keep his environment safe and make sure that he's orientated to his daily routine. We'd need to make sure that he was assisted to mobilise so that he wasn't mobilising independently if he was at high risk of falls. And we'd need to explain to John at all times what is happening. And if needed, we'd need to use manual handling aids. The third problem that I've identified from the scenario from John is that he has poor nutritional status and reduced mobility, so he is at risk of developing pressure sores. The goal would be to improve his mobility and his nutritional status and maintain his skin integrity at all times. To do that, we'd have to put in place interventions, which would be improve his nutritional status, maintain his continence, so make sure that he's not incontinent of urine or incontinent of faeces, ensure his position changes regularly in bed, observe his pressure areas daily, use pressure relieving aids such as cushions or mattresses, and record something like a Waterlow score to assess his risk of developing a pressure sore. So that gives you a rough outline of how to use the nursing process and also how to implement care plans. We have a good set of educational files which includes all this information, so if you would like the educational file, you can request that. If you want to know more about information that will help you for your interview, the next video will cover something called the Francis Report and the 6 C's, which is very important in terms of nursing interviews for the NHS and the care sector in the UK. I have to do a series of outtakes.